This is QD Clinic. Hi, I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.Live, March 18 and 19. It's all about the discussion and the interchange. It's more than our great faculty. It's what you have to say. We need experts like you at RheumNow.Live. Today's case, a young woman who presents with pain in her hands, her neck. She has Raynaud's and anemia. So she's 29. She comes in to see me with 2 months of pain all over. She says she has arthralgias that affect her arms, hands, fingers, legs, even her feet and her neck. 2 months ago, she went to the emergency room with the same complaints, was diagnosed with arthritis and pancytopenia. Yet she was given Toradol and a shot of IM, Stalumedrol, and sent on her merry way. Since then, she's taken over-the-counter ibuprofen. However, that causes really severe gastritis, and now she can no longer stand it. When I see her, she has those complaints. She doesn't really complain of stiffness, although she says it's hard to use her hands at her job. She has 1 hour morning stiffness. She has biphasic Raynaud's, no weakness, no hair loss, no history of miscarriages. She does have back pain and fatigue. She says that her hair is thinning. She has a rash, sometimes on her hands, sometimes on her face, but she doesn't have any rash today. On the exam, when we see her, she has dusky fingers, livido in the arms, 14 tender joints, no swollen joints, 12 out of 18 tender points. The ANA is 1 to 1280. That was done in the emergency room. She didn't have a pancytopenia. She actually had an anemia that was mild and a white count of 9.7. Excuse me. H&H was 10 over 32, and her platelets were 194. She did have a lymphopenia of 600. The rest of her labs were normal. So she was given tizanidine and Tylenol. We order further labs, and she comes back to the clinic a month later. She's clearly worse. She's not getting any better. Her pain is now an 8. She hurts all day long. She says she's having a hard time combing her hair and going upstairs. She's achy and the same joints hurt. Now she's having a fever up to 100 or 101, night sweats. She says when she wakes up in the morning, there's hair on the pillow. She still has the Raynaud's, but she's lost 5 pounds of weight. When you look at her, she has a malar rash, meaning she has sparing of the nasolabial folds bilaterally. She has a little bit of a rash on her chin and on her forehead. When you examine her joints, she's got plenty of swollen joints. Now all those PIPs that were tender before are really swollen. So she now has 22 tender, 8 swollen. She has other joints that are tender. When you look at her labs, she's still anemic. She doesn't have a leukopenia. She does have a lymphopenia, but her double-stranded DNA is 6,190 units. Platelets have dropped to 114. C3 and C4 are very low. She has 3+ proteinuria, and the UA has plenty of RBCs, 10 to 20 per high-powered field. Clearly, the woman has lupus. This is a new diagnosis of lupus. I presented this at the recent RWCS conference, and I asked my panel of experts, how would you manage this gal? Half the panel said they wanted a kidney biopsy. Well, this particular patient didn't have any insurance, and so that made a kidney biopsy difficult. And I asked them, could they manage this case without a kidney biopsy? And they said yes, reluctantly so. How would they treat them? They all agreed on steroids, probably starting at a dose of either 40 or 60 milligrams a day. They all agreed on hydroxychloroquine, full dose, maximum per her weight. They were split on which other agent they would use at this point. More or less 40% wanted, 50% wanted mycophenolate, knowing she doesn't have any insurance, and mycophenolate still is kind of expensive. About 40% wanted azathioprine, 2 to 3 milligrams per kilogram, and about 10% wanted belimumab, saying, hey, if she's has no insurance and has no income, you can probably get compassionate use belimumab for free. Well, she was treated with everything I just mentioned except for mycophenolate and azathioprine, meaning she got 40 milligrams of steroids, she got hydroxychloroquine, 400 milligrams, and she got 150 of azathioprine. She came back a month later, significantly better, no swollen joints, only 3 tender joints. She had no edema. She had no edema before. She still has no edema. Her malar rash was still there but faint, but she was now functional. So she's going to be seen in another month from now. Again, acute lupus is her dominant problem, and aggressive management is the prescription she really needs. I would love to have a renal biopsy in her. I told her if she's not responding dramatically at the 8-week mark, which would be the next visit she comes back, we would consider maybe transferring her to the county hospital or transferring her to a local clinical trial that would use more aggressive therapy. That's it for this episode of QD Clinic. We'll see you at RheumNow.Live. You can register for our meeting March 18 and 19. Take care.